Okay, I'm going to go ahead and get started. Again, you met me on the yesterday morning. I'm Patricia Winter. I'm a research social scientist with the Pacific Southwest Research Station of the Forest Service. And I'm delighted to be able to present our next speaker. Out of the LA Urban Center and with PSW, we've been looking at climate change and public health in Los Angeles for a bit of time now. We have a great recording on YouTube from some speakers we hosted a few years ago out of the LA Center. You'll see that on one of our posters related to public health. And most recently, we've been continuing that work in LA parks. And I just want to do a shout out to a member of our research team who really did a lot of the hard work, Jeremy Munns, who's now interning with Amigos de los Rios. So please say hello to Jeremy. He spent some very long, hot days out in LA parks, so I'm very thankful for his contribution. All right, so I have the pleasure of introducing Dr. Elizabeth Rhoades. Elizabeth earned her doctorate from the Johns Hopkins Bloomberg School of Public Health, and currently Elizabeth is the coordinator of the climate change policy and programs at LA County Department of Public Health, where she works to bring a public health voice to the decision-making process. Elizabeth is the department representative to county and regional climate change working groups. And so where we've been talking about public health and a link to policy and decision-making, here's our opportunity to hear about that in a very applied way. She founded and leads the Interdepartmental County Climate Change Committee, which brings together various LA County departments to implement the county's climate change action plan. And in 2014, she authored 2 climate change reports. I believe they're available if you Google them online, by the Department of Public Health, entitled Your Health and Climate Change. And the other report was the Framework for Addressing Climate Change. And Elizabeth will be talking about trees and public health saving lives through urban forestry. Welcome, Elizabeth.
Thanks so much for that introduction. I know it's kind of a dramatic title. Hopefully I didn't oversell it too much. But as Pat said, I work in public health, and I particularly focus on the climate change impacts on public health. So I'll be talking today about the intersection between trees, climate change, and public health. So I'll talk a little bit about, this is actually not the final version. But, yeah, I do. That's okay. I think so.
Are there 2 finals?
I don't think so. Let me just double check. So I'll be talking about why public health, and so I think that's kind of the central question of this talk, right? Why is a public health person at this conference? I know there's one of my colleagues who's at this conference, Jocelyn. Is there anyone else here who works specifically on the intersection between trees and public health? No. Oh, what do you work on? Oh, that's awesome. So for those of you who couldn't hear, she works on aeroallergens and is on a committee on asthma. So that's great. There we go. Yes. Thanks. So yeah, I'll talk about why public health, why a public health focus on these issues is so important, and about the nexus of trees, climate change, and public health, and just a very little bit on what we're doing at the LA County Department of Public Health on trees. So as I said, I focus on climate change from the public health perspective. And what we found with the topic of climate change is that framing climate change in the context of health is the most effective way to talk about climate change to get people to care about it. Research has shown that framing climate change from a health context is more effective for getting people to support climate-related policies, both for mitigation and adaptation. It's more effective than even a national security frame or an economic frame. So let's see if we can apply that to trees as well. And I think, health is very compelling because it's immediate, it's personal, it speaks to you and the well-being of yourself and your family, and that's why it can be such an effective way to frame a topic. So what I'm really here to do is provide a public health lens on this issue and hopefully kind of reinforce some of the important reasons why you all are working on trees and perhaps provide a few additional important reasons why your work is so important. So as we know, we're going to experience various impacts of climate change here in Los Angeles County, and I've listed just a few, and these few I've selected because they're some of the most salient in terms of health impacts. They're some of the most impactful impacts in terms of our health. So we're going to see hotter temperatures, both in terms of higher average temperatures, but also more days of extreme heat. This is perhaps even the most significant, not the average temperatures, but the fact that we're going to see a lot more heat waves, days over 95 degrees. We're going to have worse air quality as a result of that, and as a result of more acres burned by wildfires. And if you think, and you don't have to think too hard about each of these three impacts, these are all very solidly related to trees. So what I want to do is very briefly walk through each of these and their relationship with trees as a protective measure to help us adapt to each of these climate-related impacts. So the first, heat. As I said, we're expecting a lot more extreme heat. Have people seen this map/chart before? Is this familiar to some? Some people are nodding, some people are shaking their heads. So this came out of UCLA in 2012, and part of the UCLA's Climate Change in the Los Angeles Region project that modeled days of extreme heat projected for the middle of the century versus now. So the darker bars are what's projected for the middle of the century in terms of days over 95 degrees Fahrenheit versus the lighter bars in terms of what's projected now, and I'm seeing some people's expressions. And this is really helpful to get people to look, maybe at your neighborhood and see what's going to be, what's expected in terms of climate change for your neighborhood and extreme heat. So you can see particularly inland areas affected, but basically all parts of LA are going to see about 2 to 4 times as many days of extreme heat by the middle of the century as they currently do. And many people don't realize it, but heat is a serious public health issue. We've had hundreds of deaths in US cities as a result of heat waves in the past, including during California's 2006 heat wave, over 650 deaths. Heat every year in the US contributes to more deaths than floods, storms, and lightning combined. But it's not just the direct heat-related illness and death that's really impactful in terms of heat. It's actually the way that heat stresses the body so that people with existing medical conditions are particularly vulnerable. So in California's 2006 heat wave, we saw more than 16,000 excess emergency room visits and more than 1,000 excess hospitalizations during that time. And that's for things like diabetes, cardiovascular disease, and kidney failure, where people had underlying medical conditions that were worsened by the stress of the heat. So by excess ER visits, that means more ER visits than we would typically expect during that time period. So we're talking about a huge burden on health. And so it's not just the people who directly get heat-related illness or die from heat, but also all of the people whose health is kind of degraded due to a heat wave. So there are many ways to prepare for extreme heat, to deal with extreme heat, and trees are actually one major strategy that we're talking about. So as we all know, trees reduce the urban heat island by providing shade, by cooling the air through evapotranspiration. So broadly speaking, by helping to cool neighborhoods, trees are a health protective strategy that help us to adapt to the impacts of climate change. By cooling our neighborhoods, they actually help keep people cooler, and they can reduce the incidence of heat-related illness and death. And then also by strategically placing trees along places where people want to be active outside, along sidewalks, along bike lanes, in parks, on pathways, we can help people stay active outdoors, even in a changing climate as it gets hotter and hotter, while reducing their risk of heat-related illness and death because we've provided shade. So again, strategically placing trees in these places where people may be active outside is one component of creating a climate-resilient, active transportation infrastructure that will help protect people from the impacts of heat and allow them to continue to be active outdoors, which is what we want from a public health perspective, right? We want people to be physically active. We want them to be outside and interacting with other people. That's important. Moving on to the second climate impact, air quality. So as we know, heat worsens air quality because it speeds up the creation of ground-level ozone, which is a major component of smog. It also creates more temperature inversions that trap pollutants closer to the ground. And of course, along with drought, as everybody here knows, heat contributes to more frequent and more severe wildfires, which also obviously worsen the air quality through smoke and particulates in the air. And I certainly don't have to educate anyone here about the benefits that trees have for air quality. So again, we see trees as a protective measure, as an adaptation measure, to help us counteract some of the impacts that we're going to see to public health with climate change. So by reducing temperatures, trees indirectly improve air quality by reducing temperatures and then reducing the creation of ground-level ozone, and also remove air pollutants, with, of course, the caveat that some tree species, as we know, can release some VOCs back into the surrounding environment, so we have to be careful about tree species selection if this is our goal. Then climate impact number 3, wildfires. I'm sure some previous presentations had a lot of discussion about the impacts of wildfires and some of the predictions. So again, out of the UCLA Climate Change in the Los Angeles Region project, we see that we're going to expect by the middle of the century about 64 to 70%, 77% more acres burned by wildfires as we do now, depending on the source of the fire. Everybody here cares about wildfires for many tree-related reasons, and I care about those reasons too, and I also care about them from a public health perspective. We have, of course, the most significant public health impacts being injuries and deaths, but also people being displaced, all of the health consequences you have when services are disrupted, when infrastructure is compromised, the mental health issues that might arise from people being traumatized, and the far-reaching consequences of air pollution or decreases in air quality that can affect people dozens and dozens of miles away from where the fire is occurring. And this can range in severity from just irritation to more serious respiratory illness, and also quality of life issues that I'll talk about in a few slides. So this is a photo of the sand fire, which, as I'm sure everyone knows, burned about 41,000 acres in the Angeles National Forest a few weeks ago, destroyed 18 structures and killed one person. So obviously, the loss of life, the distress to people who lost their homes and property, the stress on people who were displaced, even if they didn't end up losing their homes. These are all the most severe and significant public health impacts of wildfires. But people around the county were also impacted in less severe but also significant ways. Tracking the Sandfire hashtag on Twitter was really interesting because a lot of people talked about the air quality impacts and their decisions maybe not to exercise outside because of the air quality, and talked about the fact that their usual adaptation strategy for extreme heat, if you don't have air conditioning, would be to open the window. That was not an option that was available to people when ash was raining down outside. And again, more people talking about even very mild physical activity causing respiratory issues, joking about it's really not a good day to be exercising outside. So these kind of issues impact people all across the county. And, if wildfires are not that frequent, they're not that severe, then maybe we're not as concerned about these impacts happening occasionally. But as wildfires get more frequent, much more severe, then this can be a serious public health impact over time, where we have people not able to be active outside, having respiratory issues, just overall quality of life impacts due to wildfires. So again, I don't have to educate this audience about drought and heat being a contributing factor that was acknowledged during this fire. That contributed to the stress that was on the vegetation and the difficulty that the fire department had in containing the fire. Healthy vegetation and healthy trees, as we all know, would have made it easier to contain. Which comes to kind of the central message of the presentation, which is that healthy trees and plentiful trees are good for public health. And they're good, as I said, for protecting us from heat. They're good for improving our air quality and counteracting some of the declines in air quality that we're concerned about with climate change. And they're good for preventing these really, really huge, severe wildfires that we're seeing, which have negative consequences for people even dozens and dozens of miles away. So you could say that saving trees helps save people's lives as well. So as I said, I work for the Los Angeles County Department of Public Health. We're one of the largest health departments in the country. We have 4,000 staff. And our responsibility is 85 out of the 88 cities in the county, as well as all unincorporated areas. So we're responsible for the health and well-being of basically all 10 million people in LA County. And what I want to convey with this presentation is that public health is here to support and validate the work that you're all doing with trees, because we see this as a very important issue. One of the things we're working on at the department is we lead the County Climate Committee, which is comprised of other county departments like Public Works, Regional Planning, Parks and Rec, Fire, and some of our other county departments. And we're working on an urban heat island reduction plan for the county, which will, of course, include trees as a major component of that plan. Both planting trees, but also acknowledging, and a lot of the previous conversations have spoken to this quite a bit, preserving our existing tree canopy. Oh, thank you. And this is actually just one of our many efforts. My colleague Jocelyn, who's here, leads our tree committee specifically, which has been working a lot on seeking out funding for tree planting and education related to trees as well, and an urban forest management plan. So there's a lot that Jocelyn's doing too. So with that, I am happy to take any questions. Yeah.
This is more of a comment. I know that we all live in, or not all of us in Southern California, but a lot of us live in Southern California. We're talking about drought-tolerant trees. And I just want to stress my belief in diversity and having some trees that are not drought dormant or summer dormant, because that's when we do have a lot of heat. And so that we need to strategically select and place trees that are actively photosynthesizing in the summer.
Thanks.
Got a question?
Okay.
Go ahead.
Hi, I'm Vanessa Torres with Santa Monica Mountains National Recreation Area. I really appreciate you talking about the public aspect of this and how it relates to health. I think that's something we haven't heard a lot about in this conference, and a lot of times these efforts that we're doing in bringing trees and bringing green space tend to happen in more affluent communities, and so being able to look at it from a public health standpoint and looking at park-poor communities and how we can bring these efforts to those communities as well is also as important. So thank you.
Yeah, and I'm really glad that you brought that up because a huge focus in our tree efforts is equity. Because as you say, you don't need to be planting trees in Brentwood. And the people who are most impacted by the climate change impacts that I listed tend to be in lower income areas. Those areas also tend to be the areas that are very tree poor. So we really need to be making sure that we're targeting these interventions in the correct areas where we're targeting highly burdened communities for things like tree planting. So that's a great point.
Hi, Lee Ayers with Tree Fresno. In your heat island reduction study, have you looked at ways to reduce the amount of asphalt?
Yeah, we're actually finding that to be the most challenging component of writing the plan. So trees are one of the major components of the plan, then also green space and cool roofs, and then cool and permeable pavements. So that would be either laying down permeable pavements in places that are appropriate to them, which is not all places because they oftentimes can't take a very heavy traffic burden, but places like sidewalks, alleys, park areas, schoolyards, all of those things tend to be appropriate. Some parking lots tend to be appropriate for permeable pavements, and then there's various coatings on asphalt and stuff that can be cool coatings. But we don't have a lot of guidance yet from the state, for example, on those kinds of pavements. So that's actually proving to be one of the more challenging sections of the plan. Any other questions?